Why do people misunderstand clinical depression? Have you ever wondered why so many people get clinical depression wrong? It's a common issue, and understanding it can help us support ourselves and others better. One major reason for this misunderstanding is that people often confuse clinical depression with regular sadness. While sadness is a normal emotion, clinical depression is a serious medical condition. It affects how the brain works and can lead to a range of symptoms that go beyond just feeling down. People with clinical depression may experience persistent low moods, loss of interest in activities they once enjoyed, changes in sleep patterns, and shifts in appetite. They might also feel worthless, struggle to concentrate, or even have thoughts about death or suicide. Because of this wide variety of symptoms, many do not see depression as a real illness. Instead, they might think it is just a mood issue that can be easily fixed. Another reason for the misunderstanding is the belief that depression is a choice or a sign of weakness. This idea can create stigma and shame for those who are suffering. Many people assume that if someone is depressed, they should just be able to snap out of it or think positively. However, clinical depression arises from a mix of genetic, biological, environmental, and psychological factors. It often requires treatment, which may include therapy, medication, lifestyle changes, and support from loved ones. Detecting depression can also be tricky. Not everyone shows clear signs of sadness. Some individuals might express their depression through irritability, anger, or restlessness. For instance, men may display symptoms differently, appearing agitated or withdrawn rather than sad. This variation can lead to further misunderstanding and make it harder for people to recognize clinical depression. Cultural attitudes can also play a role. In many societies, there is a strong emphasis on mental toughness and willpower. This can create the false impression that experiencing depression means a person lacks strength or character. Such societal views discourage open conversations about mental health and seeking help, which only adds to the confusion surrounding clinical depression. Misunderstanding clinical depression stems from confusing it with regular sadness, believing it is a personal failing, recognizing varied symptoms, and facing societal stigma. It is essential to view depression as a complex medical condition with specific symptoms and causes. By educating ourselves about these aspects, encouraging professional help, and creating supportive environments, we can better understand and cope with clinical depression.